Hi, good afternoon, and welcome to the Battle Creek VA Tele Town Hall. Today we'll be talking about community care as our main topic. I'm Brian Pikowski. I'm the Chief of Communication and Community Engagement, and I will be moderating the call today. The information today we will be presenting on the community care program and resources available to you. But first, we'll start with our Battle Creek VA mission and vision. Our mission is to provide high-quality, veteran-centered care when and where veterans need. And our vision is to be the provider of choice for veteran health care. We are happy that you choose the Battle Creek VA Medical Center for your health care needs. So again, today's main topic will be community care. After the presentation, our presenters will remain on the call to answer your questions. To ask a question, you can hit *3 to be placed in the queue. These questions will be general in nature and appropriate for the call. Any more specific questions about your health care or your health care needs will be referred to a patient advocate or the service following the call. Again, you can hit *3 to be placed in the queue to be screened to ask a general question once our presenters are done. Now it is my pleasure to introduce Ms. Natasha Watson for opening remarks.
Thank you, Brian. I just wanted to share a couple of items with you today. I really appreciate you joining us on this beautiful afternoon. First thing I wanted to share with you, I've been serving as the acting medical center director for the past 8 months, and it's really been a great journey for me. Thank you for allowing me to do that. And I wanted to share with you that Mr. Kevin Swallow, our associate director, will be taking over as the acting medical center director until Miss Michelle Martin returns from helping out over in Detroit. So effective Monday, Kevin will return and he will take over as acting medical center director. I also wanted to welcome with this veteran audience our assistant director, Dr. Janine Lovett. She came to us. She's been here a little while now, but I don't think she's been formally introduced on our town hall. She has a really great history of serving in various leadership roles throughout VA and really exemplifies professional development within the VA. She's got a strong history with lots of leadership development programs, and she is a veteran herself. So welcome Dr. Lovett as our assistant director. And then as Mr. Swallow takes over as our acting medical center director, Mr. Kevin Grady, who is normally our chief of police, will be serving as our acting associate director. So we'll welcome Mr. Kevin Grady back into the associate director chair. So I just wanted to share those leadership updates with you. Dr. Megan Kensler will continue as our acting nurse executive. I will be transitioning to our acting regional chief nursing officer role, and hopefully will return to the Battle Creek campus very soon. Next, I wanted to share with you a couple employee of the month. We have Patricia Swanson, who was selected for our May employee of the month. And she was recognized for her dedication to taking the harder right over an easier path and really exemplified the eye care values we have. Her vigilance prevented a delay in critical care, upholding the veteran's dignity, and showcased the highest standards of VA service delivery. So congratulations to Patricia Swanson, who is our May Employee of the Month. And then in June, we recognized Liz Green. Liz is an LPN at the Muskegon VA Clinic who was selected as the Employee of the Month. She joined the VA a year ago as a float LPN and has consistently demonstrated exceptional performance, initiative, and commitment to veteran-centered care. From the outset, she immediately integrated herself into clinic operations, showing a strong work ethic and ability to anticipate needs without direction. Her reliability and proactive approach have made her an invaluable asset to the PAC teams that she supports. So congratulations to Liz Green, who is our June Employee of the Month. And would like to introduce Mr. Jerry Brown, who is our Administrative Officer in our Community Care Service, and he's going to share with you some very important information when you're seeking your care in the community. So I will turn it over to Jerry.
Thank you very much, Natasha, and congrats on your new position as you're moving over to that side. Thank you all for joining today. As she introduced, my name is Jerry. I am the Administrative Officer for the Community Care Service here at the Battle Creek VA, and I am going to go through some slides about community care and hopefully get a better understanding out to you guys about it. If we can advance to the next slide. So what is a standard episode of care, a SEOC? So every referral that goes out of the Battle Creek VA has what's called a standard episode of care attached to it. That standard episode of care really drives the entire authorization. It is very specific to body parts and specialties. So an example is you're having pain in your right knee. You call your PAC provider, say, hey, I've got some pain going on. They place the referral for you. It comes through the community care process. We'll place the orthopedic standard episode of care on it, but it's only for that right knee. So if you go to the orthopedic provider out in town, and you're like, well, my left knee is also starting to hurt. They can't see you for the left knee. They can only see you for the right knee. Now, obviously, for bilateral body parts, we can put both. We can enter one referral that's for bilateral, but that's a whole other thing. We wanted to clear that the SEOCs are the ones that really kind of run all the authorization. Included in the SEOCs is also all of the things, all the testing and things that the providers can do for you, along with the number of visits and how long that authorization is good for. Not all authorizations are the same. There are some services that have 6 months associated to them. There are some that are good for a year. And all of that information does go out to the veterans in a letter. We try to send those out in the mail to you guys and get them to you as fast as possible. We do also utilize secure messaging and getting those letters out to you guys that way, or we also have the option to send it to you through email. So be checking all of those places for these letters and make sure that you guys keep those letters on hand. So before you get care out in the community, if you're ever unsure if something's going to be covered, please call the VA, call the community care department, call our call center, call the PAC team, ask the question. We're always here. We are more than willing to answer that question, whether it come from any of those. The biggest thing that community care doesn't want is for a veteran to get a bill. So that's kind of one of our guiding principles. In the next slide here, inside of community care, we also have what's called the referral coordination team, or the RCT team. Their role essentially is to review referrals that are coming in for services that we may provide here at the VA. They will contact you, the veteran, and they'll go over all of your options to be seen, whether you want to stay at the VA or if you want to go out and utilize your community care benefits. If you choose community care, they'll review everything, make sure that we have all of the prerequisites that we need completed before we can send it out to the community. They'll make sure that they select the right SEOC, and then, of course, they'll ask you about your scheduling preferences. Mainly, where do you want to go, all of that good stuff. You always have a choice in your healthcare. Moving on to the next slide. So the simple things that you can do to help with your care, because while the VA, we're here to serve you guys and we're here to help the veterans. Speaking as a veteran myself, I encourage all veterans to remember that you guys are partners in healthcare. So we work together to make sure that you get the best care possible, whether that is inside the walls of the VA or outside the walls of the VA. So to help us do that, we have to make sure that your address and phone numbers are correct in this system. I know with the new federal EHR, that process has gotten not as simplified as it was before. So please do check your DEERS profiles. Make sure your addresses are correct, your phone numbers are correct there, and those will come back into our system. And then we call the numbers that we have on file for all the veterans. And again, we send mail to your guys' home address, or the PO boxes that are listed, whatever's there. Just make sure that that stuff is up to date so we can get that information out to you. And if you prefer secure messaging, when you're talking to the referral coordination team or you're talking to a community care nurse because they called you instead, let them know, like, hey, I use secure messaging with my PAC team, and we're more than happy to utilize that method of communication as well. Always verify that you have authorization before any appointment or procedure. That's a big one, because a lot of times veterans will kind of get that letter, and I myself as a veteran, I'm guilty of it. I will set that letter off to the side and forget about it. It'll sit in a pile. But that authorization that letter will tell you how long that authorization is good for, and it'll give you the exact end date of it. So what we see a lot of times is veterans will not pay attention to that letter, and their care may be over, or they get a follow-up appointment scheduled like 1 or 2 days after that care expires. And then we have to try and get that care back in, get a new referral out. And we do our best to meet your guys' needs. But like I said, this is a team effort, and we just ask that you, when you get that letter, make sure you have it on hand and somewhere safe. The next slide is emergency care and what you need to know. So if you're going to the ER, you can ask the ER staff to report your visit to the VA within 72 hours. Every emergency room has access to this number, so they can call for you. Two important notes is telling your primary care team that you went to the ER, or if you call the Tele triage line and they tell you to go to the ER, those two actions do not meet the criteria for reporting an ER visit. So you still have to call the ER, the 72-hour reporting line for ER visits. And obviously, you don't have to. You can call and report yourself if you would prefer. You don't have to have the ER call. So those are two big things with emergency rooms that we see a lot. Here is the notification line if you don't have it. It's on the slide deck here. It is 844-724-7842. So anytime you go to the emergency room, give that line a call within 72 hours of that visit, and that goes into a queue, and we receive it. If the VA isn't notified within 72 hours, it could affect whether your emergency care gets covered. But even if it's a late notification, sometimes those visits may still be covered. So please, if you go to the emergency room for any reason, please call that number and just notify that you went. Next slide is emergency care versus urgent care. So emergency room visits are for life-threatening serious situations. Life, limb, or eyesight is kind of the rule of thumb that we go by. Urgent care is for same day, non-emergency needs, minor illnesses or injuries, stomach bug, you got a pretty deep laceration that may need a suture. Urgent cares are good for that. Knowing the difference helps, because there is a difference in the programs when we're talking about community care. Emergency room visits and self-presenting to the emergency room, those things are handled through community care here locally, whereas urgent care is a national program, and we don't have any local view on any of that. Which brings me into the next slide, which is urgent care in the community. So before you go to the urgent care, you need to go online. You can go to Find My Urgent Care. There's a VA website. It's a VA locator to make sure that that urgent care is in network with the VA. Not all urgent cares are in network. When you arrive to the urgent care, fill out the intake form and tell them that you're using your VA urgent care benefit. They will call the national urgent care line if they are in network with us, and they will get authorization right then and there. There should never be any kind of copay associated with an urgent care when you go and visit. Now, if you go to an out-of-network urgent care, by law, the VA can't cover any of that. So you may end up getting a bill for that one for out-of-network claims. So it's very important that if you're ever going to go to an emergency or urgent care, that you go online and try and find an in-network urgent care around you. The next slide is what to bring to an urgent care visit. You just need to bring your government-issued photo ID and a VA urgent card for billing, which I believe is on the urgent care, the National Urgent Care's resources. I don't know. I don't think we have that link in the slide deck, but I'm sure we can get it out at a later time. Prescriptions through community care. So if you need a medicine right away, the community care provider is allowed to prescribe you up to a 14-day supply at an in-network pharmacy. An example of an in-network pharmacy would be CVS. And of course, that was if your visit was through urgent care or on a approved referral. Be ready to share your prescription benefits information with the pharmacy. So you do have to give them the VA authorization number that comes in your letter. That way they know who to bill for that. If you don't have an approved authorization or use a pharmacy outside the network, you may have to pay out of pocket for that and request a reimbursement later. If you need more than a 14-day supply of the medicine or it's not urgent, your provider should send that prescription to your local VA pharmacy instead. All prescriptions should be coming if they're more than that 14-day supply that you need right now. They should all be coming to the VA so that we can use our formulary and fill it and get it either mailed out to you or you guys can come pick it up. The next section here is a big one. This is what is a request for service, the RFS form. Sometimes your community provider has to ask for additional services or for a new referral to continue like a yearly follow-up. Cardiology comes to mind where you typically follow them, you see them once a year, but you have to get a new referral every year. So this is accomplished by using what's called the RFS form. It is a standard VA form that goes out into the authorization packets that are sent out to the provider's offices. So they have a copy of that form. They're also instructed, they can find that form online to fill out and make sure that they get that back over to us. Now, if you ever have a provider that tells you that you, the veteran, need to fill this form out, you can tell them with certainty that that is not the case. The forms need to be filled out by the provider and sent over to the VA Community Care Department. So these forms are used, like I stated earlier, if you need more time on your visit, more visits. If there's something that the provider needs to request that isn't covered on the current authorization you have, or if they're trying to send you to a different type of specialist. Those are great examples of things that an RFS form would be used for. The next slide is knowing these two things about RFSs. So a request for additional services is not a guarantee that you'll get an approval or that your next visit that you have will be covered. Your authorization only covers the specific services listed, and new health issue that comes up, they'll need their own approval. So going back to the knee pain example that I gave earlier, where you're going for your right knee, but your left knee also started to hurt, that would be an issue or a situation where that provider would submit that request for additional services form, and then we would get you a new referral with bilateral knee pain to be seen for both. What makes your request go smoothly? So there's a few things that the provider has to supply to the VA to make sure that these RFS forms go through as smoothly as possible. One, we have to double check to make sure that the RFS forms are signed by the provider. And then we also have to make sure that they submit the supporting documentation with the request for the need. You'd be very surprised how many providers send us these forms and they're either not signed or they don't have any medical records pertaining to what they're asking for. So we have to kind of play phone tag with the provider to get all those things kind of met, which does translate into some of the delay that you guys see as the veteran when trying to get this care taken care of. So those are all good things to know about what we need for RFS form. The next is if you get an unexpected bill. What typically happens when a VA reviews the billing issue is we always ask you to check your VA authorization number and check the validity dates. If that data service that you're getting the bill for is inside of that authorization, or excuse me, is inside that validity dates between the start and the end date of your authorization, what we ask is that you call the billing department wherever you're getting that bill from. You tell them that this is inside my authorization period, and you give them the VA auth number. A lot of times, the outside billers, they have a hard time trying to figure out how to bill a community care referral, even though we send them the billing guide. So a lot of times it's something like that we have to have the veteran call, because they will not. A lot of times the billing departments won't talk to the VA. They request that we have the veteran call and provide that VA authorization number to them. Again, very important why you have that letter kind of tucked away. If your care happened outside of the approved dates, it likely won't be covered. If care was within the approved dates, the VA checks whether the provider actually billed the insurance. Again, that's that part that we ask you guys. They may ask to have the veteran call. If they haven't billed yet, they're given the authorization info and asking to resubmit. If everything was billed correctly and it's still unpaid, the VA National Billing Claims line can help you sort it out. And that line is on this next slide here. It is 1-877-881-7618. That is the phone number for the National Billing and Claims line. Again, very great resource for veterans who have some kind of outstanding billing issues. Give them a call and they'll be more than happy to help. And with that, that is the end of my presentation, and we move along into questions. I don't know if there's anything else that's being presented, Brian, or are we moving directly into questions?
Thanks, Jerry. Yep, we're going to go into some questions now, and appreciate the information. Again, we'll be able to answer general questions on this call today. Any specific questions will be referred to the patient advocate or community care team, or whichever service they apply to following the call. So keep your questions as general in nature. We'll try to answer the general part of those, and if there's specific questions about your specific health or specific case information, then that'll have to be researched after the call. So again, you can hit *3 to enter the queue to ask a question. So we're going to start first with a question from Lance. Lance, go ahead with your question. Hi, Lance, go ahead with your question.
So I'm trying to see if there's a recording to hear the presentation again, to get down the numbers and things of that nature.
Yep, thanks for your question. The presentation is being streamed live to our Battle Creek VA Medical Center Facebook page, and so it'll be also, the recording will be there on our Battle Creek VA Medical Center Facebook to review as well. So thanks for that question.
Perfect.
And that's also where you can see the slides that Jerry was referring to. So he covered most of the information verbally, but again, if you want to see the slides as a visual reference, again, you can go to our Battle Creek VA Medical Center Facebook page and review the recording of the presentation there. Next, we'll go to Henry. Henry, did you have a question or comment? Hi,
Hello?
Henry, did you have a question? Hi, did you have a question or comment?
Yes, did you hear me?
Yes, sir.
Okay, no, I just wanted to say I've been using community care for a couple years, and it's been outstanding. I get great care, and the Benton Harbor VA is outstanding. I just wanted to say that the VA has really, really done a turnaround in the last 15 years, I think. So I appreciate everything you guys do, and I get excellent service from the VA.
Oh, great. We appreciate your comments and thanks for choosing the Battle Creek VA for your care. All right. Next, we'll go to Jeffrey. Hi, Jeffrey. Did you have a question or a comment? Hi, Jeffrey. Did you have a question or comment?
Jeffrey, what's on you?
Jeffrey, go ahead.
This was for you.
Yes, go ahead. All right, we must have lost it. All right. Next, we'll go to email with a question. Email, did you have a question for us today?
It goes in the building, but I know where that's at. But.
Hi, Emil. Go ahead with your question. All right. Looks like Emil had a question about neuropathy with his feet. Does he have to have a diabetic diagnosis?
Well, they'll send me a map, won't they?
We'll probably have to follow up with email after the call to get more information on that question. All right. Next, we'll go to Timothy with a question.
Yes,
Hi,
you have.
Yep,
Yes,
go
you
ahead.
have Timothy here right now.
All right, go ahead, sir.
Yeah, my question is this: on April the 28th, I broke a tooth off down to the gum line. Fortunately, the next day I had an appointment with Drake Road Dental in Kalamazoo. They went in, they cleaned my teeth, they examined that tooth. They didn't know whether they'd be able to put a crown on it or have to extract it. I've been waiting since April the 28th to find out and haven't heard one thing from community care, have not received okay for anything on it. Now, if I was in absolute pain, this is absolutely ridiculous.
Yeah.
That length of time. It's been almost 2 months. That's ridiculous.
Yeah, I can understand your frustration there. Let me check in with the community care team. They won't be able to have specifics for you today, but if they have any general advice.
Okay, now I have called Drake Road Dental 3 or 4 times to talk to Maggie, and she was waiting on authorization from you people to do it.
Okay.
I've called community care 3 or 4 times, and I went to see the patient advocate, and he's called community care. Somebody's dragging their feet someplace. I was almost in Vietnam from basic training quicker than this. This is ridiculous.
Yeah, sir. No, I appreciate your service, sir, and let's give you some general information today on the call, and we'll have somebody follow up with you after the call.
Okay, appreciate it.
Jerry, any general advice or things on referrals like that?
Yes, absolutely. And Timothy, I'm sorry that it's taken this long to get you an answer on that. We'll definitely have Brian make sure we get some additional information so we can dive deeper offline of this for you. Dental is kind of its own. It's kind of its own beast when it comes to community care. So in April, we did move over to the new EHR, which we had a previous process in place for getting dental RFS, requests for additional services, which is what this falls under, over to our dentist and getting them out as quickly as possible. The new federal EHR, unintended side effect that no one was aware of was that process was broken. So for a good portion of April, we were struggling and working with our dental service to figure out a new process to make sure that those things flow, which we do have in place now. So, like I said, once we get that additional information, I'm happy to dig into that deeper for you. But for those who go out and seek and have dental services out in the community, requests for additional services, the way it works is that they flow into community care. Our dental team here in community care takes it uploads it into your medical record and sends it off to the dentist for review. Once we get the determination back from the VA dentist, they enter a brand new referral for you, and we give you a call, we get it sent out, and the care goes through now. That's the process that's in place now.
All right, thanks for the information. We do have another question in regard to dental, so we'll go see if we can hear this question and see if get that. Harold, go ahead with your question. Hi, Harold. Did you have a question? All right, we might have lost Harold. The other question, Jerry, looks like, why do dental referrals fall off after a year and they have to start from the beginning?
Yeah, absolutely. So the reason why dental referrals kind of reset is we're going back to that standard episode of care that I spoke about at the beginning of the town hall. That is what drives all of the care and drives specifically the length of care. So a referral, there are some dental referrals that don't last a year, but most of them do last 365 days. And you do have to re-up that care every 365. So that 1 year is a max that we can give on an authorization. So that's kind of the standard across the board, whether that's dental, cardiology, a few other services. The maximum amount of time that we can authorize it for is a year.
All right, sounds good. All right. Next question comes from Barbara. Barbara, go ahead with your question.
I got VA care, community care last year, and then I made an appointment for this year because the VA Battle Creek called me and said I need to make a visit, but I never got authorization for this year. So what do I have to do in order to get that authorization? The provider told me they had it when I made the appointment. The VA said I had it, but I have not got a letter, and I requested a letter, but I haven't got one yet.
Okay. We will get your specific information to community care after the call, but Jerry, any general information on that?
Yeah, absolutely. With every referral, we we have those three mediums of sending out the referral letter that I talked about to our veterans. We have secure messaging. We have a secure email that we can send out to your personal email address that's listed in your medical chart. And then, of course, we have the letter that goes out through the postal service. Now, I can tell you that as a veteran myself, I've had trouble getting my own letters, and I work in the building that they're printed in. A lot of times, we put the letters in the post office, and then we don't know what happens to them from there. So we try to use our other modalities kind of as our first option versus putting it in the mail, unless you specifically request it that way. I'm not, like I said, not quite sure what happened to your specific letters, and once Brian gets us that information, we'll dive into that. But that's kind of the general consensus in community care when it comes to getting the letters out. So yes, we send the letters, but we try to send them out through the other methods first, depending on your preference.
All right, thank you. All right. Next, we'll go to Dwayne with a question. Dwayne, go ahead with your question.
Hi, good afternoon. This is Dwayne. Why does community care and the VAs don't have the same rules and regulations from one state to another? I'm from Michigan. I'm a veteran, 100%. And I moved to Georgia, and I had some dental work done down in Georgia. It's called Cavis. I lived in Fort Benning area, and they sent me to different community care agencies for some dental work. They did some implants, and before they got finished with it, I moved back to Michigan, and I got back online here in Michigan and everything, and they refused to do it. They said that they don't do dental work like that, and I was wondering why.
All right, thanks for your question. I don't know if we'll be able to answer, obviously, your specific question, but any general information from community care or the team. And we will pass your specifics on to the team after so they can touch base with you, Dwayne.
Okay, yeah, I appreciate it.
All right. Thank you, Dwayne, for your question. And this is actually a very good question. So community care, we don't, in community care, we don't actually decide any of the care that gets authorized. Particularly when we're talking about dental services, that authorization comes from the dentists. So I don't know the specifics around implants and how those things get handled. That would be more of a question for the dental service and the dentist of how they determine all of that. Community care, we get the referral from dental, so they're telling us what they're approving, and we just process the authorization. So community care in everybody's care is really the middleman, because the care is being authorized by the provider. We get the referral, we process it, and send it to the community for you to get seen. But we don't make any determination of what services you're getting. That all comes from either the provider or the dentist in this case.
All right, thanks, Jerry. Any follow-up from Chief of Staff? Not specifically on this, but in general?
Hi, not specifically on this topic. We will definitely continue to follow up with you to get an answer for that, but we'll just have to see. So sorry about that. Don't have any specific answers to that one.
All right. So we'll follow up on that after the call. All right. Next, we'll go to Freddie, it looks like. Go ahead with your question. Hi, go ahead with your question.
Hello?
Hi, go ahead with your question. Did you have a
Is this me?
question or comment? Yes, sir.
Oh, wow. I was on earlier. So I spoke to someone. So, but yeah, I was basically asking a question pertaining to community care and billing, because sometimes community care, you have the authorization, it goes to whatever hospital or entity that takes care of things. And at times I was billed, and when it isn't paid by the VA or community care, whichever entity pays it, I would get the bill, and I would get a notice stating it wasn't paid and why. And they also state that the entity, the billing entity, also got the same letter and to inform them of what to do in order to get paid. From what I am seeing, because I've had this happen on a couple of occasions where I got billed or sent to collections, is that whoever is on the billing side doesn't know what they're doing or hasn't been properly trained. And it seems as if the billing entity, once they get that secondary letter from the VA stating they weren't paying it, they need to follow certain procedures in order to get paid, they throw it to collections. We're not messing with this. And you all have been outstanding, I must say that. And the thing is, I had to call National one time because of this, and they said, yes, this was this, everything was correct. But the billing entity, if they're in the network with you, it would seem that they are trained on what to do. And even the Battle Creek person on a call one time offered to train the staff at one of these entities. But it seems that all of community care or the billing entities, and maybe it's because of their turnover, who knows, but they aren't being properly trained on how to follow the VA billing or whatever it is. Can something be standardized so that someone is certified to take care of these things? Because it caused me some heartache on a couple of occasions. You know, thank goodness it was taken care of. And with that, it's just the veterans shouldn't have to go through this.
Right. No. Yep.
Like I said, you guys have been great. It's not on your end, but I'm just wondering, can something be standardized possibly so that, or this entity is certified, or signed off on that, whoever is billing or the clerk in whatever hospital, won't name names, but that way, they know what they're doing.
Sure. Yep.
They know to look for authorization numbers or what have you.
Yeah.
Does that make sense?
Yeah, it makes sense. Yep. Thanks for your question and comments, and we'll see what the team has, and appreciate the question.
No problem. Thank you very much. And again, kudos to everybody. You guys have been great.
Yep. Thank you. Jerry, any general comments on billing and follow-up there?
Yeah, this is actually a great question, so thank you for that. So there is a third-party biller that is involved when it comes to community care referrals. They're the ones who write essentially the checks for your care. It's called Optum. They're a subsidiary of United Health, and they actually send out a step-by-step billing guide to every billing department that is inside of their network. And of course, it is the job of those billers to know how to bill. But we do encounter this quite a lot, where the biller may be new, they don't know what they're doing. They think that, and as a veteran, I empathize with this a lot because I do encounter this myself. A lot of times my VA benefit gets mistaken for TRICARE for life for those retirees. So they end up billing the completely wrong person and not even Optum. So One great resource that we do have locally is our patient rep, who is located down in Building 2 with the patient advocates. Her name is Christina Roop, and I can, for anyone on the call, I can provide her extension. So you just call the main number here, the 269-966-5600. Her extension is 30752. She's really good at working with our providers and making sure that the bills, like in this case, are taken care of. She also does provider outreach and provider education as part of her duties, along with veteran outreach. But the other option that we have is if we are consistently having an issue with this particular provider, we can actually give the information over to that third party Optum, and they could reach out with their own training team and say, hey, you know, in the contract you have to be billing us this certain way. Let's work on getting this rectified.
Great. All right. We have a few questions in the chat in regard to the 72-hour line for emergency care. Can you repeat that information?
For the 72-hour line, you said, Brian?
Yes.
Yeah, absolutely. The telephone number for the 72-hour emergency notification line, this is for when you go to an emergency room visit. It is 1-844-724-7842. Again, 7842.
All right. Thank you. On also in the chat, there's some questions about where to find the recording again. And again, if you go to Facebook, to the Battle Creek VA Medical Center Facebook page, you will find the recording there, along with the slides and information. And if you're not able to find it for some reason, just give us a call and let us know. One other general question in the chat here is for contact information for community care. What's the best way for people to get a hold of community care, Jerry?
So we do have our direct phone number, which is 269-223-5011. When you dial into our telephone number there, it actually takes you into a phone tree. So if you, for example, did go to the ER and you can't remember that 72-hour line, if you call community care directly here at Battle Creek, the first option is actually the 72-hour line. So when you push 1, it'll transfer you directly there. So our phone tree's got multiple options for all the different things that you may need. And of course, there's an option in there to speak with a representative, which takes you over to somebody that can try to answer the question for you the best they can.
All right. Can you repeat that phone number one more time so people can have a chance to write it down if they need?
Yes. Yes. It's 269-223-5011.
All right. Thank you. All right. Next, we'll go to Janard Johnson with a question. Hi, Janard. Go ahead with your question.
Oh yes, I'm 100% VA from Battle Creek, and I also found out that I have Medicaid A and B. Do I really need that? Because I'm paying for that, but I don't use it. VA take care of most everything I have to do. Still good to keep it?
Yeah, well, so that's an individual decision. So we can't give you total advice on that. So you do have to look at, you know, what benefits you're getting through your VA benefits, and then decide whether you think you need the extra coverage.
Oh, okay.
because, like you said, there is a cost to that. So
Right.
sometimes the area agencies on aging can also help walk through the Medicare benefits and the Advantage benefits to let you know if there might be a reason you want to keep that as well. So if your local area agency on aging might, sometimes they have classes and things, or, presentations on that as well, but.
Do you guys have a number for that, for them?
I could get back to you and look up the local one for you. I'll do that after the call for you, because it depends
Okay.
on where you live, so.
Okay.
All right. All right, next we'll go to Reginald with a question. Go ahead, Reginald.
Yeah, good afternoon, everyone. This is the question that I have. I had a primary care. He's no longer there. That was Mike Line. He put in a consult for me for an MRI. I he put it in for both knees. This was back in May. Everyone involved, as far as my medical staff at the VA, they follow up. I've been to triage several times to get shots in my knees. I was also prescribed prednisone, but I can only take it for 7 days, which I've done. And they said I can't take it any longer because it may cause diabetes. I also received PT as well as acupuncture. Both of these needs, my PT and my acupuncture people have treated me, to try to massage and, cure the pain, as best they can. And it may last for a couple of days. But they are both asking, why is it taking so long? And I have called community care, and they told me that it has to be approved, that the council is there at community care, but it has to be approved. This has been going on since late June, matter of fact, June the 29th that I heard. And like I said, acupuncture and PT, they want to know what's going on, because maybe what they're doing, is why I won't get disapproved the MRI. So therefore, I can be diagnosed by orthopedic properly to see what's going on with my knees.
All right. Yeah. Thanks for the information. We can check into your specific information, obviously, after the call. Thanks for that. Any general follow-up on that, Jerry?
No general follow-up on that one. Just once we get his information, we can dive in.
All right. All right. Next, we'll go to Rex with a question. Go ahead, Rex, with your question.
Question I have is nothing pertaining to your main subject today. Can you hear me okay?
Yes, sir.
I live in Lawton, Michigan, retired 25 years, regular Army, 100% disabled vet. Been going to Battle Creek VA for about 11 years. The first question is, I know you went over to a new system, and I've had some incidents in the past month and a half of been put on hold through your call system, which I am a communications engineer through trade. And I've been put on hold for over 50 minutes in many departments that I've tested your system, and nobody picked up. I don't know if that's been fixed yet. I reported it probably 4 weeks ago again. I haven't called through the system to see if I'm put on hold again for 50 minutes again. And that was even with the operator. And usually, with my experience for 10 over years, your Battle Creek operator picks up within 10 minutes, which is great. But when I get transferred to another organization, another department, the time period's been over 50 minutes waiting to cancel an appointment or talk to a department, anywhere down to my wheelchair department, to my A team department, to the eye clinic, to make an appointment. The waiting list, the waiting time was way out there with no answer, so I usually gave up after 50 minutes. So if you guys could look into that, I don't know if it's been fixed yet. They were going to look into it. Another main subject I have is the caregiver program. VA in Battle Creek has done everything for me. I have neuropathy from my first combat injury, my lower spine, so I'm in a wheelchair. They have fixed a lot of things in the house here, but I did apply through my A-team provider, Dr. Wynn, for a caregiver program. And I've seen all your agencies there in Battle Creek, and they told me everything was approved all the way up to the mental department, all the way down to my all the medical inspections for this caregiver support program. I was in the system. I've been in the system for asking for this since March of this year, and I've done everything I can with the Battle Creek department, and they've told me it's over to higher headquarters, which I guess is in Wisconsin, but they don't answer the phone there either. The last time I talked to a social worker at your department, everything, I was at 72 days in the system. That was back in June 7th. They have 90 days. They have 90 days to answer you, Mr. Jones. Well, we're way past 90 days now. And I've tried to call.
Sorry. Yep. We'd have somebody follow up on that for you after the call.
Okay.
And sorry for the delay on that. We are getting towards the top of the hour here, so
okay.
I don't want to have people holding on. Sorry about the phone communication. I don't know if anybody on the call has heard that. We will certainly look into it following the call for you, and follow up on the community care or caregiver support referral for you as well. So thank you for those comments. We are getting towards the top of the hour, and we do have some questions we were not able to get to, so we will get those, though, sent out to the proper areas following the call. So I thank everybody for submitting those, so we can follow up on those questions after the call. Ms. Watson, do you have any closing remarks?
I'd just like to thank all the veterans on the call for joining us. Thank you for your service. And again, thank you for choosing Battle Creek for your healthcare needs. Have a great weekend.
All right. Yep. Thanks again, everybody, and have a great day.